Hi, my name is Ashley Farley, and this is my persuasive speech on the opioid crisis, and this is my audience. Did you know that more than 2 million Americans have been dependent on or abused prescription pain pills or street drugs? In 2015, there were 52,000 overdoses, and 33,000 of those were due to an opioid. 91 Americans would overdose each day. Opioids are legal painkillers like morphine, hydrocodone, or codone. The word opioid is derived from the word opium. Opium is a poppy seed plant that was from the ancient civilizations. They found them like the Romans, and they used them like painkillers like we do today. And then in the 17th century, the Chinese used opium to smoke it with tobacco, and that's when they realized that opium is actually addictive. Opioids bind to receptors in the brain and spinal cord, disrupting pain signals. Did you know that heroin is an illegal drug synthesized into morphine? That's why when you get into a car accident and you are prescribed morphine, it can be addictive. And then when you go home and you are addicted to the morphine and it gets too expensive, people go to inexpensive drugs like heroin. And that's where it starts the opioid crisis of getting addicted. Between 2006 and 2014, hydrocodone was the most highly prescribed opioid, and the second was oxycodone. Fentanyl is a drug that is used for terminal illnesses like cancer, and some people will buy heroin that is laced with fentanyl, and that causes a lot of overdoses. The opioid crisis is a major problem in the U.S. Overdoses keep happening each year, and we need this to stop. So we should, as a country, come together and find ways that we can help it to stop. In 2015, there were more than 52,000 people that died of overdoses, and 2/3 of those were due to opioids. Joyce Kanichik, she wrote from the Journal for Nurse Practitioners. She said there is an estimated that the opioid crisis kills more than 90 Americans each day. 90 Americans each day. The crisis is producing serious addictions that is hard for people to overcome. So we need more treatment centers to be open and readily available so that people can become sober again. And the epidemic has pushed society to look at issues related to the treatment of the disease. And people are talking about how there is not enough beds in the facilities for people, and that's a major problem too, that we need more treatment centers that have open beds for people that are trying to get sober. So I have 3 big reasons of why we need this to happen. First is doctor overprescribing. The second is treatment centers, and the third is border security. So the first I'm going to talk about is doctors overprescribing. And do you ever wonder why Americans have so many opioids? And the answer to that is that they get them from doctors. So in 2012, U.S. practitioners wrote 259 million prescriptions, and I feel like that is a large number for people who are getting medications. One governor that is from Julie Pureman. They wrote that they were trying to make it so that people who prescribe medications have at least 5 hours of training every 2 years, and I think that's a pretty good way to stop this crisis. Is that if we have people who are prescribing medications are realizing how many that they're giving out. So in this, I have Martin A. Makery. He wrote, "Overprescribing is a major contributor to the opioid crisis." He's pretty much saying that doctors are giving large amounts of medications out, and that's causing some overdoses. And we should not have so many. We shouldn't have 90 milligrams of morphine being distributed, and that's causing overdoses from doctors overprescribing. So if we want to uptake this opioid crisis, we need to first stop the doctors overprescribing. My second reason is treatment centers. We need these to be less expensive, and we need them to be readily available to people who want to get sober. And we shouldn't be forcing people to get sober. We should have them want to. And one of the most important changes required to address the opioid crisis in Massachusetts is that increasing funds for voluntary treatment services. And that's said by Julie Perlman. She's from the American Journal of Law and Medicine, and she says that they're doing this law where people are pretty much voluntarily getting treatment and not being forced. So it's making them want to get sober, and I think that is a pretty good way for people to overcome this addiction. And my third reason is border enforcement. We have people coming in and out of countries with drugs and cartel activity, and if we get laws for this to stop, then I think we would be better off as a country and a more sober nation. So they were having pesticides killing the drug plants, and that was causing respiratory disorders and miscarriages. And I think that's a pretty dangerous way to take away this opioid crisis, when we could just do it in a more safe way by just eliminating the doctors overprescribing and the border enforcement and having more treatment centers that are really available. And the harmful practices targeting people who grow crops used in manufacture of drugs, that's from ScienceDirect.com. The conclusion, now that I've talked about the opioid crisis and what needs to be done for this issue, I hope you'll help after hearing this speech, because we really need this to stop. We really need to focus on the overprescribing of pills from doctors. We need to have treatment centers readily available, and we also need to make sure that we have border enforcement that are enforcing the drugs that are coming over the border. Young people are dying, and this crisis will not stop without you. Thank you.